Hi, I am Dr. Sindhura, a consultant in the Department of Emergency Medicine at Continental Hospitals, Hyderabad. Here I am today to talk about heart attack. What causes heart attack? A heart is usually supplied by arteries known as coronary arteries, and any narrowing or occlusion in any of these arteries due to some clot formation within the lumen of these arteries will result in the heart muscle damage. The particular area that is supplied by those affected arteries in the heart is all disrupted with the essential nutrients, oxygen supply and blood flow, thereby causing the heart muscle to die. Within just a matter of 30 minutes of time, the heart muscle starts getting irreparable and irreversible damage within itself, and that is why time is muscle. So it is not an exaggeration to tell that every 33 seconds in India, one suffers a heart attack. That common is heart attack in India these days. So early recognition, rapid diagnosis and the prompt treatment is the key to success while treating patients with heart attack. To recognize a patient with heart attack, the most common symptoms that we all have to know are the pain is classically described as central chest discomfort or central chest tightness, or sometimes the patient can specifically point out and tell that the pain is on the left side of the chest, and this pain can be radiating to the left arm, to left shoulder, to left side of the neck or to the left jaw, and sometimes in the left side of the teeth as well. Sometimes the person can also experience profuse sweating, lightheadedness, dizziness and feeling of one's own heartbeat, which is called as palpitations. However, in severe cases, the patient can also have shortness of breath, and it is specifically in women these days that they come up with these atypical symptoms like nausea, vomiting, generalized weakness, extreme easy fatigability and generalized discomfort. And in diabetics, the heart attack usually becomes as a silent heart attack. Having said about the symptoms of heart attack, the worst case scenario is we've seen patients coming to us in a sudden cardiac arrest. So when someone is suffering with a pain, specifically chest pain, if any one of us is able to recognize the pain to be a cardiac chest pain, the first and foremost thing that we all should do is to call the medical assistance. And the second important thing is to consider, if available, to give a tablet aspirin, which is in the form of 325 mg oral tablet. And this tablet can be administered to the individual only if the individual is not allergic to aspirin. So upon arrival to the emergency department, we emergency physicians, with the help of the pre-hospital EMS personnel in coordination with the in-hospital interventional cardiologists, with the help of 24/7 cath lab technicians and nurses, help in rapid diagnosis of the patient, and that the tools that we have in the ER for rapid diagnosis are the ECG, the electrocardiogram, and fast cardiac biomarkers like high sensitive troponin I. And with these cardiac markers, we diagnose the patient with heart attack, and based on the severity, we take up the patient for the next treatment. So the treatment options can be a clot dissolving agent called as the thrombolizing agent, which should be given in less than 30 minutes of time. And the second option is to do a diagnostic angiogram followed by a primary angioplasty, in which a stent is deployed into the narrowed artery, thereby clearing the artery away with the clot. And this particular thing has to be done within less than 90 minutes. So whenever, like we have already discussed, whenever the heart arteries are narrowed or blocked because of a clot, it disrupts the oxygen and blood supply to some particular part of the muscle. And if this is left untreated for more time, more muscle gets lost, and there is more worse outcome in a patient. Also, we have to be very aware of the complications that a patient can have after a heart attack. The heart rhythm can get disrupted, and the patient can come to us with either too fast heartbeat or too slow heartbeat, thereby further causing a drop in the blood pressure. And sometimes there can also be some build-up of fluid in the lungs, or some lightheadedness, and all these complicated heart attack patients are those who might end up their life if left untreated on time. So we at emergency medicine department in Continental work in coordination with the pre-hospital setup, with the in-hospital resuscitation till the cath lab procedure, followed by the rehabilitation of the patient in a very comprehensive way, thus helping a lot of patients recover very fast without any with uneven full recovery in the process. However, there have been a lot of advances in the treatment of heart attacks. Still, prevention is the key. So let us all stay healthy, eat right, stay fit, and change our lifestyle. Thank you.